The 7 best exercises to relieve sciatic nerve pain. Hello, guardians of health. Ready to transform your health today? Have you ever imagined waking up without that annoying pain radiating from your back down to your leg? Well, we're talking about the sciatic nerve, the largest nerve in the human body, which can cause intense discomfort when inflamed or compressed. Did you know that simple, strategic movements can be the key to relieving this pain? Studies show that specific exercises help reduce pressure on the nerve and improve quality of life. Today, I'll share with you the 7 best exercises you can do in the comfort of your home to relieve sciatic nerve pain naturally and effectively. This condition affects millions of people worldwide, often limiting daily activities and even sleep. But with a few routine adjustments, it's possible to regain mobility and confidence to live pain-free. Get ready, because the tips you'll learn today could make a big difference in your health. Let's explore these exercises together and see how they can transform your well-being. Let's go. Piriformis stretch. Immediate relief for the sciatic nerve. The piriformis muscle is a small structure located in the glutes that, when tense, can directly press on the sciatic nerve, causing pain and discomfort. Stretching this muscle is one of the most effective ways to release compression and bring immediate relief. This exercise is simple yet powerful, especially for those suffering from sciatica. To perform the piriformis stretch, lie on your back with your knees bent and feet flat on the floor. Cross the ankle of the affected leg over the opposite knee, forming a 4 shape with your legs. Then, gently pull the knee of the opposite leg toward your chest until you feel a light stretch in the glute. Hold the position for 20 to 30 seconds and repeat 2 to 3 times on each side. The benefits of this movement go beyond immediate relief. It also improves circulation in the gluteal region, reducing inflammation and promoting greater flexibility. Studies suggest that stretches like this can help prevent recurring sciatic nerve pain, especially in people with sedentary lifestyles. Pigeon pose, yoga. Releasing tension in the hips. Pigeon pose is a yoga classic for relieving accumulated tension in the hips, an area often responsible for sciatic nerve compression. This position allows for a deep stretch in the pelvic and gluteal muscles, providing almost immediate relief. To practice pigeon pose, start on all fours on the floor. Bring one knee forward, placing it between your hands, and extend the other leg back, keeping your hips aligned. Gently lean your torso forward, resting your arms on the floor, and hold the position for 20 to 30 seconds. Repeat on the other side, ensuring both hips are equally worked. This exercise not only helps release the sciatic nerve but also improves overall hip mobility. Additionally, by relaxing tense muscles, pigeon pose reduces accumulated daily stress, promoting an overall sense of well-being. Scientists point out that practices like yoga can be as effective as painkillers for chronic pain. One advantage of pigeon pose is that it can be adapted for different levels of flexibility. If you find it challenging to perform the full pose, use pillows or yoga blocks for support. This helps maintain proper alignment and prevents muscle strain, making the practice more comfortable and accessible. Hamstring stretch. Flexibility to reduce pain. The hamstrings, located at the back of the thighs, may be more related to sciatic nerve pain than you think. Tight muscles in this area can increase tension in the lower back and pelvis, exacerbating sciatic nerve compression. For this reason, stretching this area is essential to reduce pain and improve mobility. To perform the hamstring stretch, sit on the floor with one leg extended forward and the other bent, with the sole of your foot touching the inner thigh of the extended leg. Gently lean forward, trying to reach the foot of the extended leg with your hands. Hold the position for 20 to 30 seconds and repeat with the other leg. Make sure not to overdo it, the stretch should feel comfortable. In addition to relieving pressure on the sciatic nerve, this exercise promotes greater flexibility in the leg muscles and improves circulation in the lower body. Studies show that regular hamstring stretching can significantly reduce episodes of lower back pain, a common factor associated with a compressed sciatic nerve. Another notable benefit of hamstring stretching is its ability to prevent muscle injuries. By keeping these muscles flexible, you reduce the risk of strains during physical activities or sudden movements in daily life. This is particularly useful for those who play sports or exercise regularly, promoting safer and more efficient performance. Seated spinal twist. Relieve pressure on the spine. The seated spinal twist is a simple but powerful exercise to relieve pressure on the sciatic nerve. This movement stretches the back muscles, improves spinal mobility, and reduces tension that may be compressing the nerve. To perform this exercise, sit on the floor with your legs extended in front of you. Bend one leg, crossing it over the other, and place the foot next to the opposite knee. Place the hand corresponding to the bent leg behind you for support, while the opposite elbow gently presses against the bent knee. Twist your torso in the direction of the bent leg, looking back. Hold the position for 20 seconds and repeat on the other side. This movement helps realign the spine and alleviates sciatic nerve compression. It also promotes a deep sense of relaxation, especially for those who spend long hours sitting. Experts in musculoskeletal health suggest that gentle spinal twists can significantly improve flexibility and reduce pain. Another added benefit of the seated spinal twist is that it also aids digestion. The compressing and stretching movements stimulate the abdominal organs, adding to the overall benefits of this exercise. This makes it an even more complete choice for your self-care routine, combining postural health with general well-being. Practicing the seated spinal twist regularly is ideal for anyone looking for a convenient exercise that can be done anywhere. Whether after work or before bed, set aside a few minutes for this stretch and notice the difference in how your body responds to pressure relief. Cat-cow pose, yoga. Gentle relief for the spine. The cat-cow pose is a classic yoga practice that combines stretching and spinal mobility. This exercise alternates between arching and rounding your back, helping release accumulated tension in the muscles surrounding the sciatic nerve. It also promotes a deep sense of relaxation. To perform the pose, start on all fours, with your knees aligned under your hips and your hands under your shoulders. As you inhale, arch your back downward, lifting your chin and tailbone toward the ceiling, cow pose. As you exhale, round your back upward, bringing your chin to your chest and tucking your tailbone under, cat pose. Repeat slowly 6 to 8 times, coordinating the movements with your breath. This dynamic movement not only reduces pressure on the sciatic nerve but also improves circulation along the spine and relieves lower back pain. Studies show that exercises involving spinal mobility can be extremely effective for people suffering from chronic pain. In addition to providing immediate pain relief, practicing the cat-cow pose regularly contributes to better posture in daily life. Strengthening the stabilizing muscles of the spine helps reduce tension caused by poor posture habits, such as slouching at work or while using a phone. This postural correction is essential to prevent worsening conditions like sciatica. Gluteal mobilization. Strengthen and relieve tension. The glutes play a crucial role in supporting the spine and stabilizing the hips. When weakened or tense, they can contribute to sciatic nerve compression. Exercises that mobilize this area help strengthen the muscles, release tension, and consequently relieve pain. Start with the glute bridge exercise. Lie on your back with your knees bent and feet flat on the floor. Slowly lift your hips until your body forms a straight line from your shoulders to your knees, squeezing your glutes. Hold the position for 5 seconds before returning to the starting position. Repeat 10 to 12 times. In addition to relieving sciatic pain, the glute bridge improves trunk stability and prevents future injuries. Studies indicate that strengthening the muscles around the sciatic nerve is an effective preventive approach against recurring pain. Another significant benefit of glute mobilization is improved circulation in the lower back and legs. This increased blood flow not only speeds up muscle recovery but also reduces inflammation around the nerve. As a result, you'll experience longer-lasting and consistent relief, especially when combining these exercises with stretches. Incorporating mobilizations like the glute bridge into your daily routine is easy and practical. Combine this exercise with stretches to maximize benefits and feel your glutes become stronger and healthier. directly contributing to sciatic pain relief. Walking or gentle movements. The simplicity of natural relief, as simple as it may seem. Walking is one of the most effective ways to relieve sciatic nerve pain. Gentle movements help improve circulation, reduce inflammation, and release accumulated tension in the lower back and hips. Walking promotes a natural alignment of the spine, allowing the sciatic nerve the space it needs to function properly. Start with short walks of 10 to 15 minutes on flat terrain, wearing comfortable shoes. Keep an upright posture, with relaxed shoulders and your gaze forward. As the pain decreases, gradually increase the time and intensity of your walks. For quicker relief, combine walking with deep breathing, which helps relax the muscles and reduce stress. Regular walking not only alleviates sciatic pain but also contributes to overall health by strengthening the heart, reducing stress, and helping with weight control. Studies point out that low-impact physical activities are essential for those suffering from sciatica, promoting faster and safer recovery. The path to a life free of pain. Sciatic nerve pain can be challenging, but with the right exercises and consistency, it's possible to alleviate symptoms and regain quality of life. From stretches like the piriformis stretch and pigeon pose to simple practices like walking, each step taken in this direction positively impacts your health. Remember that small daily changes can bring significant transformations. Choose 1 or 2 exercises to start today and see how quickly relief can come. Over time, incorporate other movements into your routine to keep the sciatic nerve healthy and prevent future flare-ups. So, which of these exercises are you most excited to try? Let us know in the comments and share how they've helped you. Don't forget to subscribe to the channel for more health and wellness tips. Until next time, guardians of health. Stay strong, healthy, and keep thriving.